bunions do tend to be hereditary. You inherit the foot structure, and then external factors such as injury, inflammatory conditions, footwear, the sports you do can impact on this, and a deformity can form and progress. A bunion is not just a lump that forms on the side of the foot. Some people think that we should simply knock this off, but that's not the case. When you look at an X-ray, you'll see that the bunion is more than just a lump. It's actually the angulation of the bones. The bones are in the wrong angle, and it's the bone that's actually protruding, and then the big toe moves over to the little toes. It has a big impact on the foot structure, because you lose that supporting part of the foot. So the foot does tend to collapse slightly, and it changes the loading pattern of the forefoot. And that's why we see associated toe deformities with hammered lesser toes, pain underneath the ball of the foot. And it can also lead to midfoot pain as well, and put strains on other supporting structures of the foot, like tendons, which can come under a great deal of strain and injury. Unfortunately, once bunions are there, the only way to correct them is with an operation. However, you can make them more comfortable by wearing wide-fitting supportive footwear and shoes with a stretchy upper. Often patients come in and the main complaint is bunion pain because of the pressure of footwear over this area. But for the functional part of bunion pain, I always talk about taking a door and twisting on its hinges and opening and closing it. Those hinges eventually will fail. Well, the same thing's happening with a bunion, the angulation of the big toe. The toe will start to ache because it's not functioning in the correct angle. So these patients might benefit from insoles to put inside the shoes to support the arch and offload the big toe joint, take some of the pressure off that joint to make it work a bit better. It will not correct the deformity, and it's unlikely to stop progression, but it can help with pain. But the problem with insoles is, of course, they take up room in a shoe, and if shoe restrictions are already concerned, it's just going to add to that, really. Bunion shields, will stop the shoe irritating the bunion. Toe spacers can stop the toes from rubbing. Toe alignment splits can sometimes help with discomfort, especially after a busy active day, but they will not correct the deformity and they will not prevent progression, but they can make this more comfortable. I also talk about hallux valgus bunion deformity as, I think of it like a hammock. You've got two small bones called sesamoid bones that sit underneath your big toe joint. You've got ligaments surrounding the big toe joint that give you stability. And I describe it as you're falling out of the hammock. So what you'll see is, as you fall out of the hammock, it can be slow, and then suddenly it'll be quite dramatic. And when you look at the X-ray, you see these small bones, the hammock, which should be underneath the big toe, and now on the inside of the toe, and the metatarsal bone is protruding out, that gives you the bunion prominence. And that's why you lose stability. And that's why sometimes insoles can help. But again, there's the issue with footwear. Toe alignment splints will not change the situation because they did not change the angle of the metatarsals. There are lots of procedures to correct hallux valgus deformity. It's choosing the correct procedure for the presenting deformity, and that's why an assessment with X-ray is needed, and also an examination of the foot to check for mobility and flexibility of the joints, and to look at the overall foot alignment on standing as well. When do we correct? When do we consider surgery? Well, when conservative management fails to help, you can no longer accommodate the deformity in footwear, and it causes general aching and pain around the big toe joint. But as well as this, sometimes I see patients that don't have pain around the hallux valgus or bunion deformity, but what they do have is pain on the central metatarsal heads, the ball of the foot, and they start to see that their little toes start to deform, or they might start to get midfoot pain. And the reason for this is that once you've lost the stability of the big toe, the foot loading pattern changes and you put more stresses on other structures. And that's what gives rise to pain underneath the ball of the foot, toe deformities, and midfoot pain and arthritis, and can put strain on tendons around the ankle, which are trying to support the foot and ankle as well. So if this happens, it's worth considering having surgery to correct the hallux valgus deformity, and it's important to choose the correct procedure because we may give you a good cosmetic result, but what we want is a good functional result. This is not a cosmetic problem. It's a structural problem that needs to be addressed. Or should I say, it's not just a cosmetic problem, it's also a structural problem, a functional problem that needs to be addressed. This very much depends on the procedure that we carry out to correct the deformity, but you're looking at 6 weeks protected in a special sandal, or possibly 6 to 8 weeks in a boot, depending on severity of deformity and what we need to do to correct it. The aim is to get you standing and walking as soon as possible, albeit in a protected way. And it's important to move around, as it's safer to move around. But we do need to allow bone to heal, and bone does take time. And that's going to be a minimum of 6 weeks. One of the complications of surgery is recurrence, and also one of the complications is over or under correction of the deformity. Again, this is all down to choosing the correct procedure for the presenting deformity. What we're trying to achieve is anatomical alignment of the big toe, sesamoid bones, and the metatarsal. If we do that, then the chances of recurrence are small. But if we don't get full correction at the time of surgery, then there is a higher risk of recurrence of deformity. If you're in your 20s and have this procedure, then of course you've got a lot of years ahead of you for it to come back. Whereas if you're older, you've got less years ahead of you for it to come back. So there are lots of things to consider. In terms of what you can do to prevent it coming back, well, especially within the first 3 months, you need to protect the foot as much as possible, avoiding footwear that pushes the toe back to where it was, so to speak. You don't want to stretch out those ligaments that we're trying to heal in the correct position. And just, especially in the first 3 months, you need to be mindful of the fact that it can take time for these structures to strengthen. And then it's just being careful with shoes, your choice of footwear going forward. You can still wear more formal fashionable footwear, but when you are doing most of your walking or sporting activity exercise, just make sure you've got the right shoe for that activity.